Hi and welcome. I'm trying to learn medicine. Today, Pernicious anemia, and after we've done it, we're going to do short impingement training. And if you participate in the short impingement training, then it's at your own risk. And this is part 2 of a Pernicious anemia. And we're talking about internal anatomy, the blood system, diseases, and this is now medical advice, which is treating about. Now, Pernicious anemia. It is a form of anemia which develops when the bone marrow lacks vitamin B12 or other substances needed for the proper formation of blood, or other substances. Maybe we're going to name it like that, or maybe we're going to say just vitamin B12. Okay, but we're starting with anemia. Anemia there is when there are not enough hemoglobin cells in the blood. Hemoglobin is transported by oxygen in the body, and if someone has not enough of them, that is anemia. And the symptoms of anemia are shortness of breath, dizziness, disturbed vision, insomnia and headache and palpitation and chest pain and ankle swelling and pallor of skin. I don't know what it means, so that's why I don't remember it. Pallor of skin. Okay, pallor of skin. And was anything else here? Okay. And when the symptoms of the Pernicious anemia, that is called, when there are different types of anemia, different reasons, and the Pernicious anemia, that is vitamin B12, which is missing. Vitamin B12, we're going to say vitamin B12, because if we say other substances and don't explain an iron deficiency, and I don't really understand that part, maybe that's also the reason. We're going to say vitamin B12, but maybe we're going to say other substances, but not iron deficiency, because that would be iron. The condition is common in people with blood group A and in those with blood group 0. So the symptoms: tongue is sore, smooth and inflamed. Persistent diarrhea, tingling in fingers and toes. In severe cases, the facial skin may assume a lemon yellow tint. Okay, Pernicious anemia, vitamin 12 is missing, and tongue is sore, smooth and inflamed, in places inflamed, sore, smooth, inflamed, and persistent diarrhea, tingling in fingers and toes. Fingers and toes. And the face can have a lemon yellow tint. Okay. Duration persists until treated, maybe we can mention it somewhere that fits. Causes: failure of the stomach to produce an enzyme, the intrinsic factor, which is needed for the absorption of vitamin B12. And the causes that the human body does not produce or has. The stomach is not producing an enzyme. The stomach is not producing an enzyme to make itself able to absorb vitamin B12 out of the food. Failure of the stomach to produce an enzyme which is needed for the absorption of vitamin B12 from food. The failure results from autoimmunity, certain drugs, or follows the removal of the stomach. I don't get it. Because it seems to be all external factors. Autoimmunity, okay, but that's not external. Maybe we're going to mention it. When it would be, we're going to say it in the exact list without explanation because I don't really understand it. Autoimmunity, certain drugs, or stomach removal. Gastrectomy. Autoimmunity, certain drugs, removal of the stomach, gastrectomy. Gastrectomy. Complications. With early treatment, these are few. They may include heart failure, degeneration of the spinal cord, and cancer of stomach. If early treated, the conditions consists forever basically, if until treated. Consists forever, except it is treated. If the treatment is early, then complications like cancer of the stomach, spinal cord degeneration, and heart failure may be avoided. With early treatment, the complications are few, and the complications include. They don't say that these listed ones, heart failure, degeneration of the spinal cord, and cancer of the stomach, are less likely if the treatment comes but I think we haven't expressed this 100% directly. I think what we mean is that these three complications, for example, are less fewer happening. We don't say that literally, but I think that's what we mean. Treatment in the home, none. Take lots of patient. Okay, there is a course of vitamin B12 injections. We're going to remember injections. Maybe this book's from the 80s, they're already tablets, but let's try to remember injections. Vitamin B12 injections. The only types of pernicious anemia which can be prevented are those which have an underlying cause, such as removal of the stomach, gastrectomy, or prolonged treatment with an anti-epileptic drug. That would be. Now here, what I'm wondering about it. What do they mean now with certain drugs can cause it? Do they mean medicamentation? For example, anti-epileptic drugs. Prevention. The only types of pernicious anemia which can be prevented are those which have an underlying cause, such as gastrectomy or prolonged treatment with an anti-epileptic drug. You can stay away from that. I don't really know how it fits with the rest. Outlook, good. After the initial course of treatment, injections must be given indefinitely to stop recurrence. Okay, what was the first sentence? After the initial course of treatment, injections. What do you mean with initial course of treatment? After the initial course of treatment, we're just going to say, we're making a separation. We have to give it for a time to treat it, and then we have to give it out by separating it. Okay. I think we have it all together. Are we able to do this? Pernicious anemia. No, the first thing is I don't know how to pronounce it. Pernicious, I'm going to say pernicious anemia. First, going to explain anemia. Less hemoglobin, oxygen carrying. And when I try to list as many symptoms as possible, then we're going to do the other thing. When the stomach is not producing the. I think we're going to start directly with the explanation. The stomach is not producing the enzyme necessary to absorb vitamin B12. And the reasons for that can be removal of the stomach, certain drugs, or what's the other thing? Autoimmunity. So we mean an autoimmune disease. Autoimmunity, certain drugs, gastrectomy. Gastrectomy. Directly gastrectomy. Gastrectomy. Autoimmunity, gastrectomy. And certain drugs. And when the symptoms are furthermore by that thing are then sore tongue, inflamed, and there was something else, but smooth. And then there was also persistent diarrhea. And then there was also, in severe cases, the lemon yellow tint of the face, and one in the lip. Tingling in fingers and toes. When you're going to say the causes, did we already what meant? It has to be, if treatment is early, then complications like degeneration of the spinal cord. I think that's interesting. Degeneration of the spinal cord. Do we mean with the spinal cord? No, but these are not the bones, but are the nerves inside. The spine are the bones, the vertebrae, but the spine and the spinal cord are the nerves inside of the spine. Why degeneration of the spinal cord? If it would be the bones, it would maybe make sense. But the blood is not getting. No, it wasn't here. It was in histology. But so I want to mention that. Degeneration of the spinal cord, cancer of the stomach, and heart failure. And I think it was and there are vitamin B12 injections earlier when these don't happen. It has to be taken indefinitely, but the outlook is all good. I'm going to start the camera and let's start. Pernicious anemia. Anemia overall, that is when there is not enough of the hemoglobin cells in the blood. Hemoglobin is normally transporting the oxygen in the body around, and by anemia, there are not enough of them. And the symptoms of anemia, they are palpitation, shortness of breath, disturbed vision, and swelling of the ankles, and chest pain, and indigestion, and loss of appetite, lack of appetite. Now, in pernicious anemia, there is a specific type of anemia, where is the stomach not able to produce an enzyme necessary to absorb the vitamin B12 from the food. And the reasons for that are certain drugs or autoimmunity or also stomach removal. And the people then have also who have Pernicious anemia have an inflamed and sore and smooth tongue. It cannot be. Yes, sore and smooth. What do I mean with that? What would happen then? This is the changing of fingers and everything. And then directly basically treatment and the complications. Pernicious anemia. Pernicious anemia is a type of anemia. By anemia, there are not enough of the hemoglobin cells in the blood, and hemoglobin is transporting the oxygen in the body. And the symptoms of anemia are shortness of breath, or dizziness, or disturbed vision, palpitation, loss of appetite, lack of appetite, and also indigestion, and chest pain and swelling of the ankles. And now by pernicious anemia, there the stomach is not able to produce an enzyme necessary to absorb vitamin B12 from the food. And the reasons for that can be autoimmunity or stomach removal, or also certain drugs. Now, and there is treatment against it. There are vitamin B12 injections, and if they're taken early, then complications like heart failure or degeneration of the spinal cord can be avoided. And symptoms of a pernicious anemia are then furthermore inflamed, sore and smooth tongue, and persistent diarrhea, and tingling of fingers and toes, and also in severe cases a lemon yellow shading of or coloring of a face. And that is according to Keith Hodgkin's Family Medical Advisor book, page 72 and 73, but this is no medical advice. I think I forgot the thing of that. Okay. Maybe I said it all. I don't know. I'm going to stop the camera over time. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine, where we're going to do maybe sickle cell anemia. Maybe we're going to do something else. We're going to do now the shortened pinchment training. If you stay and participate in the shortened pinchment training, that's better the hour-mask. We are doing short circuits. If you participate in this, better the hour-mask. Go to the stable stances, we're doing short circuits. And backwards. Front. Down and out. And now, long arms, strong fists, sink as far back as you can with the shoulders. High up, front, down, again, back, front, down, and now they are down, back. And to the next exercise, we are doing the word lifter. Long arms, strong fists, shoulders down and together, and turn the arms to the inside. Arms to the outside, shoulders down, together. Arms to the inside, shoulders down, together. Arms to the outside, shoulders down, together. And the next exercise, the arms up and a bit in front. Then the arms in front and the shoulders down, together. Arms back, shoulders up and front. And the arms in front, shoulders down, together. Arms back, shoulders up and front. And release. And now lift the arms up and shoulders up and release it down. Again, the arms up. Shoulders up and down. Arms together and down to the outside, down to the inside, and again. Another stretching. One arm in front, shoulder stays back and down. Pull the arm in, have flat fingers. Try to relax the arm, go a bit back with the shoulder, and turn the thumb up to the sky. And the other arm in front, shoulders back and down, pull the arm and have flat fingers. Try to relax the arm, go it back, shoulder, turn the palm up to the sky. It was a short impingement training. I thank you very much and until next time.